How is a biopsy taken to diagnose stomach cancer? Imagine trying to find a tiny clue that could confirm a serious illness. That's exactly what a biopsy does when diagnosing stomach cancer. It all starts with a procedure called a gastroscopy. During this procedure, a doctor uses a long, thin, flexible tube called an endoscope. The endoscope has a small camera and a light at its tip, which helps the doctor see inside your stomach. The doctor gently inserts the endoscope through your mouth, down your throat, and into your stomach. This allows a clear view of the stomach lining to spot any suspicious or abnormal areas that might be cancerous. Once the doctor sees an area that looks unusual, they use special tools passed through the endoscope to collect tiny tissue samples. These tools include small forceps or brushes designed to carefully grab pieces of tissue from the stomach lining without causing much discomfort. These small tissue samples are called biopsies. The entire process usually takes between 5 and 20 minutes and is often done while the patient is sedated to keep them comfortable. To help reduce gagging, a local anesthetic spray may be applied to the throat, and a mouth guard might be used to protect the teeth and keep the endoscope steady. After the tissue samples are collected, they are sent to a laboratory. There, trained pathologists examine the samples under a microscope to look for cancer cells. This microscopic analysis is the most definitive way to confirm whether stomach cancer is present. Sometimes, if there is suspicion that the cancer has spread beyond the stomach, such as to lymph nodes or the liver, a different type of biopsy called a needle biopsy may be performed. This involves inserting a thin needle through the skin into the suspicious area, often guided by imaging techniques like computed tomography scans or endoscopic ultrasound. These image-guided biopsies help reach deeper tissues or areas that cannot be accessed through the endoscope. Preparing for a gastric biopsy usually involves fasting for about 12 hours beforehand and stopping certain medications like blood thinners, but only under medical advice. Recovery from the procedure is generally quick, with most patients able to go home the same day. Mild side effects such as sore throat, bloating, or gas from the air introduced during the procedure are common but temporary. Risks are low but can include bleeding, a tear in the stomach or esophagus, or reactions to sedation. If you experience any concerning symptoms after the biopsy, it's important to contact your healthcare provider promptly. In summary, diagnosing stomach cancer with a biopsy involves visually inspecting the stomach lining with an endoscope, collecting tissue samples from suspicious areas, and analyzing those samples in a lab. If needed, additional biopsies guided by imaging can sample deeper tissues or lymph nodes. This process follows established medical standards to ensure accurate diagnosis and proper staging of stomach cancer. Always remember to consult your healthcare professional for personalized advice and care.